my name's Savannah, and this is Janelle, and we are going to tell you about the sweet truth. Did you know that the average American consumes 45 gallons of soda every year? Liters. Okay, I messed it up. That was like a nerve.
Oh.
Okay. My name's Savannah, and this is Janelle, and we're going to talk to you about the sweet truth. Did you know the average American consumes 45 liters of soda per year? Soda contains sugar and cariogenic acidity. The acid is also known as phosphoric acid, carbonic acid, and citric acid, which you can find on the back of the label. Sugar and acid combined actually causes cavities, or in other words, decay. Okay. And then we are also going to talk in our poster board about sweeteners that are good for the oral cavity, because some sweeteners are bad, such as xylitol, which is a good sweetener, and aspartame is a bad one.
The reason we wanted to present this topic was because we wanted people to know the cariogenic effects of sodas and sugary drinks. We wanted to give people the knowledge to be able to enjoy their favorite drinks without causing any harm to their oral cavity. Some ways that we told people to do this was to use artificial sweeteners or replace some of the beverages with sugar, with things like unsweetened tea or black coffee or water.
Sugar is actually a sticky substance, and the sticky substance likes to sit on your tooth and combine with bacteria. Once you consume the cariogenic beverage, the acid will stick to the sugar and the bacteria, which is what causes decay and cavities.
So the first case study that we looked at talked about xylitol, which is an artificial sweetener that is good for your teeth. So the conclusion of the study was that they still need to do more research on this sweetener, but it can prevent decay.
How does it prevent decay?
It didn't say in the study, it just said it prevents decay. So then the second study we did, a group of scientists studied a 25-year-old man who constantly drank cariogenic beverages throughout his workday. And the conclusion of this study was that soft drinks can cause dental caries and enamel erosion. They recommended that he use fluoride and limit the intake of the cariogenic beverages. And the third study was done on a series of children from low fluoride areas in their plaque accumulation and sugar consumption. The total amount of caries that the children had was 35 to 63%, and they all had an increased amount of plaque. Only 0.7 to 5.4% of the children had a higher sugar consumption than the rest. So the conclusion of this study were that the two factors in combination were always worse than each factor.
Each factor individually?
Yeah.
So combined it was higher than adding them together?
Yep.
Okay.
So the last case study we did, the Department of Cardiology and Dentistry studied 23 patients, their saliva, and aesthetic restoration of cervical caries caused by consumption of soft drinks. Caffeine consumed causes metabolic adhesion. What does that say? I don't know what that says. Okay. Basically, it has the same effect as drug addiction. I don't know what this says because it's like separated, but I still don't know what that says.
Brain dopamine system?
Yeah, dopamine. It's like
Doping
Yeah,
or trying.
doping. Okay, so the conclusion of this study was that the cause of caries was poor oral hygiene and the consumption of soft drinks. They accelerate the progression of cavities, and caffeine has a stimulating action on the respiratory centers
Vasomotor and respiratory centers
in the brain by increasing cardiac contractibility. The patient treatment started with patient education and ended with brushing twice a day.
The results of all these conclusions is you get less extrinsic staining, less caries, less future dental work. You'd also get less demineralization on the teeth, and you pretty much save money as well.
So
By doing what? 'Cause
By
this-
not consuming cariogenic beverages. And then you-
So what we found out, okay. So the pros of using artificial sweeteners, like we said before, are reduction of caries and better periodontal and overall health. And some cons of using artificial sweeteners would be the taste alteration and the limitation of diet.
And the what?
The limitation of diet.
What does that mean?
Like if you have to use artificial sweeteners, it'll limit your diet because you'll have to take away the sugar.
Okay.
And then the conclusion of our poster board is limiting cariogenic beverages to meal times. Also, drinking in one sitting, swishing with water after drinking a cariogenic beverage. Also, that some sweeteners like such as xylitol are healthy for your oral cavity. And to also prevent caries, you could use a fluoride mouthwash or a fluoride toothpaste, such as Crest Pro Health or Listerine for the mouthwash. And you can brush twice a day, just better oral hygiene habits.
And then here's our references.
Okay.
That was absolutely terrible.
Yeah.